My name is Bonnie Moore. I'm a physician here at Hematology Oncology Associates of Fredericksburg. My dad was a Marine at Quantico. My mom was a student at Mary Washington, and they live in Warrenton. Fredericksburg kind of made sense. I knew the community and wanted to be close to family. I really liked everybody, and it seemed like a good fit. And so I've been here for almost 6 years now. The cool thing about being an owner and being a part of this practice is being part of something for your community, being part of something that you get to shape how you give patients care, taking pride in it, trying to figure out the best way to provide patient care, having a support group for our patients, having an embedded palliative care program. If we need a new medication on our formulary, I don't have to ask a board to approve it. We just say, hey, is this the right thing for our patients? And we can bring it on board. Ownership lets you do that, and it lets you be part of how the next 10 years, the next 20 years is going to look. When I meet a new patient for the first time, one of the things that's really important for me is to make sure I understand who they are, what's important to them, what their understanding of their illness is, why they're coming to see me, and what they value most. I want them to feel listened to and to feel comfortable asking me questions. We're going to be on the same team together. When they let us in to their lives, we get to go on a journey with them too. All the important milestones that make life special, we get to be some small part of that. I think that's unique to oncology and a little bit unique to our practice because we are smaller. I think one of the biggest things, if not the biggest thing that makes HOAF unique is the staff. The way our teams are structured is there's a physician with either a nurse practitioner or a physician assistant, 1 or 2 nurses, and medical assistants. We all bring different things to the table as far as patient care goes. It really lets us be on the same page with how we implement a treatment plan. If there's complications that arise or new issues as we go along, making sure that that patient has as many people to support them as possible. Our staff really does get to know our patients and gets to care about them like their own family. We have a relationship with all the hospitals in the community, Mary Washington, Stafford, and at Spotsylvania. Although we're not part of those hospital systems, we view our relationship as the same collegial and trying to do the best for the community and the best for our patients. The cancer navigators provide a lot of support for our patients and help with transportation and help with counseling and disability applications, things like that. I'd like to see us to continue to embrace the newest therapies, continuing our research, and trying to provide more and more trial options for patients here locally. Having to travel for a clinical trial is a real burden. Compassion incorporates a lot of things, striving for more research and striving for better drugs and striving for better treatments, but also recognizing that behind everything is a human being that's going through a lot. And at the end of the day, that's the biggest thing that matters, is that there's a person that is vulnerable. I think HOAF does mean hope. I very much appreciate the amount of compassion I see from our staff. It's incredible bonds that we build.